Talking about stuttering, this presentation is intended for caregivers of individuals who stutter. The overview of the presentation, we will talk about causes, signs and symptoms, assessment, and treatment. So the cause of stuttering is unknown and not agreed upon. There are many theories that exist out there, including the influence of genetic differences, differences in brain chemistry, psychological differences, language processing differences, cognitive processing differences, neurological differences, differences in the child's dealing with stress of speaking, and differences in the child. They might be more fearful of stuttering or more aware of disfluent moments. There are some consistencies within the research, including the influence of gender, where boys they are more likely to stutter than girls. Age, it's more likely for individuals to stutter between 3 or 5. And genetics, an individual is at a greater risk of stuttering if they have a family member who stutters. So here are a few types of disfluencies that are specifically better indicators of true stuttering than other types of disfluencies. They include part word repetitions such as t-t-tu, single syllable repetitions like tu-tu, or the, prolongation where the vowel is held out like book, block where there's a struggle to get the word out like cat, or broken words where there's a block within a word like about. There are other types of disfluencies. Many types of disfluencies can be present in the speech of fluent individuals. These types of disfluencies include interjections, where you're inserting filler words, revisions or abandoned utterances, where revisions you might change a word in the middle of speech, or abandoned utterances you might stop the thought and begin a new sentence. Or repeating multisyllabic words or phrases like she said, hi. That's not typically a good indicator of stuttering. It's actually just a different type of disfluency. Cluttering is a different type of speech disorder where the speech breakdown is due to poor speech planning, or they sound like they're speaking too fast, or not well organized speech. Cluttering generally has more other types of disfluencies rather than the stuttering-like disfluencies. So during assessment, your child would see a speech-language pathologist who is likely to gather recordings of their speech in different contexts in order to analyze it. They might look to see what types of disfluencies they have, to see if they're more of those other types of disfluencies or stuttering-like disfluencies. Or they might ask your child questions about how the disfluency is impacting their life. They might also ask you about how you react to moments of your child's disfluency. So two main types of treatment are fluency shaping and stuttering modification. The goal of fluency shaping is to eliminate all stuttering by modifying all speech in all speaking contexts. The primary goal of stuttering modification is to modify moments of stuttering by educating and desensitizing the individual in order to improve the way that they see their own disfluency. Some other types of treatment that are out there but are pharmacological, which is not recommended because there's not much efficacy to support this, and there are many negative effects of medication, and the use of fluency enhancing devices. This generally is used with other methods such as fluency shaping and okay, so fluency shaping techniques. You would the speech pathologist would take the individual through more and more difficult speaking tasks and teach them in a way that doesn't allow for stuttering. So this includes prolonging speech, taking longer pauses, modifying breathing patterns, and sometimes they use artificial devices like the one I talked about earlier, such as a delayed auditory feedback device, which changes the way it sounds and is supposed to influence the fluency of the individual. Efficacy here requires the individual to be fluent in all the different speech conditions. Stutter modification requires the identification of stuttering and associated behavior. Then the speech pathologist would try to help reduce the severity and tension of the disfluent moments by helping minimize your child's fear They might do some